Hi, my name is Sable. I'm going to be your nurse. We're going to go ahead and do your physical assessment, okay? Do you have any questions?
No, I don't.
Can you go ahead and state your name?
Sean Fennell,
And where are you, Sean?
the hospital.
And what time is it?
9 o'clock.
Okay, and can you count in increments of 5 for me until I tell you to stop?
5, 10, 15, 20, 25, 30.
Thank you. Alright, I'm going to go ahead and start by inspecting the skin. I'm going to be looking for color, for texture, any lesions, any abrasions of some sort. I'm going to go ahead and check for temperature and skin tutor in the upper and lower extremities. Good. I'm going to go ahead and inspect the back. Alright, perfect. I'm going to go ahead and look at his hair, look at the hair distribution also on his arms and his legs. Look at the color of his hair, the distribution on his head, and the texture of his hair. Next, I'm going to go ahead and look at his nails. If you could put your hands out for me, we're going to be looking at for cracking, if there's any ridges. We're going to look at some capillary refill as well. Perfect. And if you could put your nails together, I'm going to assess for clubbing. Good. And then do the capillary refill on the feet. Perfect. Wash my hands. All right. Next, I'm going to go ahead and look. We're going to do his assessment of his head. We're going to be looking at the size and the shape of the head. Go ahead and palpate. Good. If you can open and close your mouth. Perfect. If you can clench your teeth like you're chewing. All right, perfect. I'm going to go ahead and let me know if you have any discomfort. All right, perfect. Next, we're going to assess the face. We're going to be looking for symmetry of the face, the color of the skin, and if there's any lesions or abrasions. I'm going to go ahead and take a cotton ball. This is what the cotton ball feels like, Sean. I'm going to put this on your face with your eyes closed and just say yes when you do feel it, okay?
Okay.
Close your eyes.
Yes. 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 Yes.
Okay, perfect. Alright. Next, I'm going to go ahead and we'll do some facial expressions to test your cranial nerves. If you could go ahead and smile for me and frown and purse your lips like you're whistling. Alright, perfect. And we're also going to do, what's the other one? I'll come back to that. Okay, we'll go ahead and go to the ears. I'm going to go ahead and inspect the ears, anterior and posteriorly as well. Anterior. Good. We're going to go ahead and palpate the ears. Okay, good. I'm going to go ahead and grab my tuning fork. If you could cover one of your ears for me, please. I'm going to say a couple of letters or words or numbers to you, and if you could just reiterate them to me.
ABC.
Perfect. And then cover that ear. Same thing on this side.
1, 2, 3.
All right, sounds good. Next, this is a tuning fork. I'm going to go ahead, it vibrates. I'm going to put this on the top of your head. Let me know if you can hear this better in one ear or the other, or if you hear it equally.
Okay. Equally.
Okay, perfect. I'm sorry. I'm going to go ahead and put this on the back of your ear. If you could let me know when you don't hear the vibrations anymore.
Okay. 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 Good.
That's good. Okay. And then next, we're going to go ahead and assess the nose. We're looking for any deviations, any lesions or ridges on the nose. Go ahead and palpate. And my pen light are going to look into the ears. Good. No drainage as well. We're going to go ahead and we'll do the mouth. We're going to inspect for the color of the lips, if there's any dry or cracking chapped lips. I'm going to go ahead. Can you open your mouth for me, please? We're going to look at the teeth. We're looking at gums, any dental canaries. We're looking at the mucosal, make sure it's moist. The hard palate. We're also looking at the tongue. Go ahead and put some gloves on. I'm just going to take a tongue depressor, Sean, and then just inspect the back of your throat as well, okay?
Okay.
You could just open your mouth, and you could say, ah. All right, perfect. Throw that away. I'm going to take this gauze pad as well, Sean, and we're just going to move your tongue to the side, and I'm going to look at your soft palate. So open your mouth and stick your tongue out. Stick it to the right and left as well. Look at it. Perfect. And stick your tongue out again. Good. And this side. Oops. Sorry. Good. Okay. Next we're going to go ahead and assess the eyes. I'm going to be looking for the hair distribution of his eyebrows, on his eyelashes, his eyelids. We're looking at the sclera of the eyes, the irises, and the pupil as well. I'm going to be palpating the paraorbital region, looking at the conjunctiva as well. There we go, perfect. We're going to do some tests, Sean. If you could cover up one eye and then read the lowest line on this card, please.
374258.
Perfect. And then the other.
374258.
Perfect. Okay. That down. If you could cover one eye for me, please. And then look at this pen light and uncover that. Perfect. And then the next eye, if you could do the same thing. Look at the pen light. Alright, perfect. I'm going to go ahead and if you could follow my pen light and not move your head. Okay, perfect. And then also follow it up and down. Okay, good. And then we'll go ahead and look into your pupils. Good. I'm going to take a peek at my notes. And we're going to do okay. Alright, we're going to go ahead and do the neck. So I'm going to inspect the neck. We're looking for tracheal deviation, jugular vein distension. I'm going to go ahead and palpate, make sure it's midline. Palpating for tracheal tug as well. Sean, I'm going to go ahead and have you take a drink of water. Do not swallow until I tell you to do so. I'm going to go ahead and tilt your head. And we're going to palpate your thyroid. And go ahead and swallow. Okay, and then one more sip of water. For the other side. Tilt your head and swallow. Okay, good. Also for the neck, we're going to go ahead and palpate the nodes, lymph nodes in the 9 spaces. So there's 1, 2, 3, 4, 5, 6, 7, 8, and 9. Okay, and if you could go ahead and turn your head right and left, if you could, please. And shrug your shoulders. Good. And then turn your head left again. Good. And right. And shrug your shoulders. Very good. Okay, so next we're going to go ahead and do his chest assessment. If you could go ahead and take your gown off. Can you make sure the things are according to it, please? Okay, perfect. So while Sean's taking his gown off, we're making sure the cameras are working. Alright, so for his chest assessment, we're going to make sure that the symmetry, it's symmetrical. We're looking at his work of breathing, use of accessory muscles, any bony deformities as well. We're going to go ahead and palpate in a Greek pattern formation. Let me know if this is comfortable for you in any way. Alright, good. We're going to go ahead and osculate lung sounds as well in the Greek pattern. Good. Okay. We're going to go ahead and have you turn around so your back is facing me. For the posterior aspect of the chest, we're inspecting the same thing: work of breathing, use of accessory muscles, rate and rhythm of breathing, any bony deformities as well. We're going to go ahead and palpate the Greek key. Okay. We're going to go ahead and assess for tactile fermentus. So if you could say 99 for me, Sean.
99.
And again.
99.
And again.
99.
Good. We're going to test for thoracic expansion. So if you could take a big deep breath in for me. And let it out. Alright, perfect. We're going to also bow back here, test for some CVA tenderness. Let me know if this is uncomfortable for you in any way.
No. No.
Okay, good. We're going to go ahead and percuss in the intercostal spaces. And auscultate. Deep breath. Good. Deep breath. Good. Alright, I'm going to have you lay down, put your head towards that end of the bed. Perfect. Okay, next we're going to go ahead and assess his heart and vessels. So upon assessment, I'm going to be inspecting for any palpitations, any heaves, any thrills. And we're also going to go ahead and palpate the cardiac area. Okay, good. So while assessing, I'm going to be assessing his aortic valve, which is the second intercostal space, right sternal border, his pulmonic valve, which is the second intercostal space, left sternal border, Erb's point, which is a third intercostal space, left sternal border. We're going to be assessing the tricuspid valve, which is the fourth intercostal space, left sternal border, mitral valve, which is the fifth intercostal space, midclavicular line. We'll be assessing for S1, which is the closure of the mitral and tricuspid valve. If there's a murmur heard in S1, it would be a systolic murmur. And then S2 is the closure of the aortic and the pulmonic valve, and if there's a murmur heard there, that would be a diastolic murmur. And to back up, going back into the chest and lung assessment earlier, if I were to hear any abnormal sounds, then I would test for bronchophony, egophony, and then whispered pectorally. So I'm going to go ahead and auscultate his heart sounds. Use the bell. Good. I'm going to go ahead and palpate his temporal arteries, his carotid arteries. I'm going to go ahead and auscultate with the bell the arteries as well. I'm going to go ahead and assess his pulses, his radial pulses, making sure they are bilaterally even, if they're normal, weak, or bounding. His brachial pulses, we're going to go into the popliteal as well, which is behind the knee. Same thing, bilateral.